Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolf. We're joined tonight by Dr. Colleen Bridger, and this is our COVID-19 update for the San Antonio community. As of yesterday in San Antonio and in Bexar County, we have 461,093 people who have received their first dose vaccine, as well as 263,611 people who are fully vaccinated. Both numbers that we are very glad to see. Those continue to tick up considerably day to day. More than 3 months into our Bexar County vaccination drive effort, almost 60% of residents 65 and older have received at least one dose of the COVID-19 vaccine. This shows, again, the tremendous effort by all vaccination sites and hospitals to prioritize those who are over 65. Recent vaccine analysis also shows that 30% of all Bexar County residents over the age of 16 have received at least one dose of the vaccine. As a reminder, as others continue to wait for their vaccine appointment, let's continue to wear our masks and social distance as we work to get those vaccines out. As a reminder, Metro Health still has some COVID-19 vaccine appointments reserved for those who do not have access to the internet. If that is you, you can book your appointment by phone by calling 311 and hitting option 8. The 311 hotline hours are Monday through Friday, 8 a.m. to 5 p.m., and Saturday and Sunday, 8 a.m. to 12 p.m. Remember, you can also subscribe to our vaccine appointment reminders, be alerted by text when vaccine appointments become available for registration. You can do that by texting vaccine or vacuna to 55000. Tonight, we are reporting 159 new cases of COVID-19, which brings our total to 205,258 since the pandemic began. Our 7-day rolling average on cases is 183. Our positivity rate, here's some good news, has dropped a bit more. We're now at 2.05%. Fortunately, we also have no new deaths to report today, but please, again, bear in mind that this pandemic has taken quite a toll on our community, and every single one of those who we've lost, we continue to mourn for, so please keep their families in your prayers tonight. There are 192 COVID-19 patients in our local hospitals this evening. That's up a little bit from yesterday. There were 20 new admissions in the last 24 hours, 78 patients in the ICU tonight, and 38 on ventilators. Let me turn it over now to Judge Wolf.
Yeah, thanks, Mayor. I think it's really important that we all continue to be careful. If you notice in the news coming out today, that infections are on a rise across the United States. There were some 61,545 infected people last week. That's 11% more than the average for the last 2 weeks. So this variant B117, they know they've got over 8,000 cases of that, and it's 50% more transmittable. So let's not let up our guard. We're sure we're probably some of that here, and we don't want to take a chance of another outbreak. We are rushing as fast as we can to get shots in the arms. We'll had about 5,000 people out at the University Hospital site today, and we expect probably another 1,000 or so more for the last 2 hours. Last week we did about 29,000 vaccines, and that was all basically school and school personnel, some via bus drivers. And tomorrow we should be opening up a registration for more people for the rest of this week and for next week.
Great, thank you, Judge. Now, last week we introduced a frequently asked question of the day. These are the questions that Metro Health at our 311 hotline receive regularly. And during the briefing, we're going to continue to share those questions each day. Tonight, we are lucky to have Dr. Bridger, who will be answering our question. And that is, if a vaccine, Dr. Bridger, is showing 95% efficacy, does that mean that 5% who are vaccinated would still get COVID-19?
So I encourage people not to think of it in terms of 5% and 95%, but rather think about the fact that what this is saying to you is that it's not 100%, and that a very small number of people may still get COVID after they've been vaccinated. But the key is that somebody who has been vaccinated will have a less severe form of COVID than somebody who has not. So even if you're vaccinated and you get COVID, you will not have as bad of the illness as if you had not been vaccinated. So everybody should be vaccinated.
Great, thank you, Doc. And I also want to remind you of one other critical need in our community, and that is our blood supply. The South Texas Blood and Tissue Center is reporting that blood demand is up 30% over last year, and unfortunately, our blood donations have remained low because of the pandemic. Again, it is completely safe to give blood, and we need you to do so now. We are at critical levels with just over a 3-day supply, and in fact, type O blood, which is the type used in emergency, remains extremely critical at just under a day's supply. For example, at the South Texas Blood and Tissue Center this morning, we had orders from hospitals for 230 units of type O blood, and we had just 73 units available. Blood shortages have real impacts on patients, and it may in fact end up saving someone's life, your donation. So please consider that and schedule an appointment as soon as you can. southtexasblood.org. You can also call University Hospital, schedule an appointment at 210-358-2812. And there are some drives being held available throughout our community. I do want to thank Councilwoman Jada Andrews Sullivan. Will be hosting one at Velocity, Texas, at the Merchants Ice Complex at 1305 East Houston Street this week. I'll be joining her for that, so please look for a drive or schedule your own appointment. Finally, if you are struggling through this pandemic, paying for rent or mortgage, note that there is an emergency housing assistance program available to you. You can call 311 to access that, or you can also call 311 for information on our job training program. If you're out of work and without an income, you can enroll for training for jobs that are available today in our community by calling 210-224-HELP. As always, you can get the latest on COVID-19 by texting COSAGov to 55000 or by going to the website covid19.sanantonio.gov. Please continue to do your part. San Antonio, we are doing very well, but continue to mask up, practice social distancing and proper hygiene. Do it for yourself, do it for your family, and do it for San Antonio. Dr. Bridger, myself, and the judge are available for questions.
Judge Wolf, when are you expecting the 500 immigrant boys to arrive at the Freeman later on this evening?
I think they'll be there within, some of them will start getting there within the next couple of hours, I believe. Got to remember, we signed this contract at 2 o'clock on a Friday. I was out at the Coliseum grounds most of that day. And today, Colleen Bridget and I went out there along with Commissioner Rebecca Clay Flores and went out to the site. Volunteers, let me thank them. We had Catholic Charities, people from Valero showed up Saturday and Sunday, 200 each day. Put up all the cots. There's about 2,000 cots we saw in there today. Catholic Charities was sorting all of the clothes that are going to be there, whether they're jeans or shirts or shoes and slippers, as well as the bedding for the cots, pillows along with blankets. So it's moving fast, and the hospital not hospital, but the separate facility for those that may have COVID is just about finished, and so I think they'll have some there probably within the next couple of hours.
So far, we know HHS has said it's only about 500 boys. Do we know this is not a co-ed center, if we're correct? We have two separate facilities there. One of them for kids that have not, they tested before they come. If they're negative, they go into the large facility. There's a separate facility that can handle up to 300 and that's separated between those that are asymptomatic COVID and those that have symptoms. So it's a separate facility away from where the rest of them will be there. It'll be boys, mostly teenage boys, 13, 14, 15, 16, 17, and we'll see how many show up. But I think I know we'll start getting them tonight, I believe. But no females, no girls will be housed at the Freeman, or you are expecting girls to show up and you're just going to house them in a different part of the Freeman?
There's no girls. It's all boys that will be housed there, so we won't have a separation problem between the sexes. We do have a separation problem, change from people that have COVID to those that don't.
Do you know how long the children will be there?
It varies anywhere from 5 to 9 days as a general rule. But if someone has COVID, they may be there longer. They may be there 14 days or have been exposed to it. So it varies, and they do their best to try to get it to a relative or someone close to the family. And in most cases, they're able to do that. In some, they're not, and those would be sent to St. Peter, St. Joseph, or places like that handle them.
Will every child that arrives be given a COVID test?
They will, but Colleen Bridget went out there with me today, and we met some people from CDC, and Colleen had a meeting with them, and so Colleen, you might want to follow up on those.
The protocol that they have in place is that everybody, staff and children, will be given a COVID test every 3 days. So they're tested before they get on the bus to come to the Coliseum. If they test positive, as the judge mentioned, they'll go to an isolation facility there at the complex. If not, they'll go into the general population. But every 3 days, they will be given a COVID test.
Are we expecting more children to arrive later on this week? I know you mentioned that there's approximately 2,000 cots.
There's 2,100 cots within the facility of those that do not have COVID, and there's about 300 available for those in a separate facility. I don't know, whether we'll reach that many at any one time. I don't know that. I just know that we're getting the first ones coming in, and that's the max we can handle there.
Do you expect additional children to arrive daily?
It's my understanding they will size up as they go. I think they're going to do it in batches of about 500, and so that they don't get, too many of them there at one time. But the Health and Human Services controls the facilities. That's who's running it. And they do have facilities in other parts of the country. I think at Fort Blitz, I think they're taking up as many as 5,000. So there's various different emergency facilities. Carrizo Springs, I think they're bringing another one there. So we're one of others that are in other communities.
How have communications been with HHS as this process has gone forward?
Well, the good thing about it, Jose Gonzalez is running the facility for HHS along with all the other entities that are there, and he lives here in San Antonio, and we've been in constant communication with him. He took us on the tour today, and Colleen had a chance also to meet with him and to talk to him. In the city of San Antonio, let me thank the mayor and Colleen and the city manager for stepping up and helping with some of the professionals that you have from Head Start. Y'all want to say something about that?
Yes, we have 40 Head Start staff who are filling in temporarily while the contractors are onboarded and brought to San Antonio. So it was a rather last-minute request on last night, and we had 40 individuals there today to help out when these 500 young boys arrive later this evening.
Judge, sorry. The emergency intake center is right next to the AT&T Center. There's a Spurs game there tonight, and of course there's going to be more. Have the Spurs or anyone at the center cooperated, or have they had to do anything different?
Well, we have them in what we call our Expo Center, which is about 200,000 square feet. There's a street in front of the Expo Center where some of the cars that may be going to the AT&T Center might drive by, but we have fencing there to segment it away, so the Spurs game will be able to go on, and there won't be any problems with access to the Spurs games.
Is Lackland still being considered as a potential location to house migrant children?
Yes.
Yeah.
Is that where the girls are going to be going, or do we have any update on?
No.
I don't know.
We don't have any specifics about Lackland other than the fact that they still want to have it as an option should they need it.
Judge Wolf, is the registry that you mentioned in your opening remarks going to be for those over 80, or will they be for all ages?
Well, anybody that is over an 80, they just need to show up. They're going to be brought to the front of the line. I think we've already done about 300 of those that are 80 and older. The sign-up will be for those that are now eligible to do it, which is basically everybody.
Dr. Bridger, is there any concern with the expanded eligibility today that it may actually be harder for some Texans to get a COVID shot because they're competing with more people who have just become eligible?
Yes, that is a concern for us. We are still very much focused on vulnerable populations. That's why, as the judge mentioned, all of the mass vaccination sites have said, if you are above 80 years old, just come and we will vaccinate you. Don't worry about navigating the online registration or anything like that. And so I expect, as we are able to fully vaccinate all of the 80-year-olds who wish to be vaccinated, we'll move down to the 70-year-olds, for example. We're really trying hard to make sure that we have multiple systems in place so that people who don't have access to the internet still have access to get appointments.
Dr. Bridger, how many of the 30,000 appointments made available at the Alamo Dome last week have been booked?
So all of the online appointments, which I believe is about 2/3 of them, have been booked. We are, as the mayor mentioned, we still have some limited appointments available for people who call 311 who don't have access to the internet, and our community health workers who, again, are specifically working with people 65 and up. They also have some appointments, and they're going into communities with vulnerable populations over the age of 65 and making appointments for them.
Are any vaccine providers reporting difficulties with residents who show up without an appointment?
Not that I'm aware of. I mean, we've been doing this a couple of months now. I think people understand what the rules are. And again, if they're 80 or up and they show up without an appointment, we will open the gates wide and let them in and give them their vaccine. Otherwise, if it's onesies and twosies, they're explained what the process is.
Judge Wolf, going back to the unaccompanied minors, do we know where the girls are going, or why are they not being brought here? We're just not getting very many answers on.
I don't know where they're going. I know that I believe by a large percent it's mostly boys that have been coming over. As you know, they started on the southern border of Mexico, coming up through Mexico. So it was a very difficult trip, I would imagine, for most of them. So I think it's mostly boys, although I know there are some girls, but I don't know where they're going to take them.
Judge, how much money is the county receiving from HHS for providing the shelter space?
Well, I don't think we received anything yet, but everything that we do is reimbursable. For the 40 people that went out there today, for our personnel out there, they're paying rent like anybody else would pay rent, and so there will be no local taxpayers' dollars being spent there. It's money that's coming through the, immigration services from the federal government.
Mayor, what are the city's plans for allowing Easter celebrations and camping at Brackenridge Park?
Yeah, I know that this has been a disappointing and difficult year for everyone. We're asking for your patience, though, as we try to put this pandemic behind us. We do not have the resources to properly enforce public health protocols for overnight camping during Easter, but we are encouraging folks to visit the park, get outside, enjoy some recreation, get together with your household outside as best you can, but there won't be any camping overnight during Easter this year.
That's all we have tonight. Thank you.